Welcome to the Eye of the Needle podcast, where we discuss healthcare innovation and explore how visionary entrepreneurs and change leaders are reshaping the future of our industry.
Welcome back to the Eye of the Needle podcast. I'm your host, Pam Arlotto. Today, we are exploring one of the biggest shifts in modern healthcare, the move from traditional enterprise IT to truly AI native systems. And I'm joined by someone who is right at the center of this transformation, Rinku Patel. She is CEO and co-founder of Polysight. Rinku has multiple companies that she has worked with, founded, and developed that are at the intersection of data, clinical insight, and technology. She's, in fact, a pharmacist by her original background. Polysight are redefining what it means to build AI into the DNA of a healthcare enterprise rather than just bolted on old architecture or old structures. So in our conversation today, we will dig into how AI differs from the systems we've spent decades optimizing, why AI-first platforms are changing everything from workflows to decision-making, and what it will take for clinicians and healthcare executives to become truly AI literate. We'll also talk about being an entrepreneur in this reality of AI and how do you build a company in this new era, and think about what it will take to be successful, from building a tool that truly brings value to your customers to meeting investor expectations and ultimately designing the future of healthcare and how we do business in our industry. So today's going to be a very forward-looking, honest discussion where we talk about where AI is taking healthcare, not just what it can do, but where it is taking healthcare and what the future will look like as we get this right. So, Rinku, welcome. And why don't you give our audience a little more detail about you, your background, and your company, Polysight?
Oh, thank you, Pam, for having me. As Pam mentioned, I am a healthcare professional by background. I've spent a number of years wearing the white coat and taking care of patients in the early stages of my career. And over the last 20 years or so, I have focused my time, effort, and energy in building technologies that have facilitated better care in various aspects of healthcare, particularly pharmacy, which is the industry that I come from. But ultimately, at Polysight, I'm really passionate about bringing a solution that could help healthcare professionals like myself not only manage patient care, but do so within the regulatory environment, and healthcare being one of the most heavily regulated industry, provide tools that could expedite that journey of compliance and regulatory change management, so that clinicians have more time to take care of patients as opposed to the administrative work. So I'm really excited to be here talking about AI in healthcare, and I look forward to our conversation.
Well, I do as well. So let's kind of set the stage for our audience first. I'd like to think about how we are evolving from traditional information technology to the future and how AI is going to play a role. So from your background, how is AI similar to and yet different from traditional IT and analytics systems that we have traditionally had in healthcare?
Yeah, and when I think about traditional software tools in healthcare, they were primarily designed to document, right? Like when I was in pharmacy school, it was like engraved in our brains where if you didn't document, that means you didn't provide care. And so when you think about the technology tools that have been around and that were developed, they were sort of revolved around storing and organizing information, basically digital filing cabinets. And what they captured was sort of the process of how care was provided, what was your interaction with the patient, and those types of activities that were more of documentation. What's different now is what AI fundamentally does with that information. So instead of simply collecting the information, it can not only just read and understand it, but it could actually draw connection across different information sources in real time and assist that clinician in providing care. that's a game changer, and that's different than the traditional system of capturing, storing data so that we could analyze it later for analytics or for trending to find patterns and performance of retroactively looking at how the care was provided. Now we're shifting into the world of AI where clinicians are going to have the benefit of truly a co-pilot that could help them provide better care with the complex set of information, historical and in real time.
Well, I think about we've implemented so many large enterprise systems, whether it's an EHR or an ERP or other point solutions over the years. And what we end up with is a lot of our people having to be the glue between all of those systems because they're not all connected and they're doing kind of what you talked about, that documentation and data storage, et cetera. So what limitations have these systems had beyond this, labor, kind of us being the glue between it all, that you really believe in your heart of hearts that AI can help us overcome?
Yeah, I think fundamentally, this is just, my opinion, but the traditional systems were assuming that the process of providing care and using a tool, whether it was an EHR or data warehouse or whatever tools that we utilize in the healthcare environment, that process was static and that the information about the patient, about, whatever clinical protocols, about whatever processes that we were managing would change at a pace that people could manage. But the reality is there is tremendous amount of information. It changes very, very fast. And there is a fluidity to that information management, information flow, and how that gets utilized in the process of caring for a particular patient in any healthcare environment. And so I think what's different now is that in the world of AI, we will have the ability to not only manage that velocity of change in a real-time manner, but to use that interpretation and that judgment support that AI can provide to hopefully provide better care and more comprehensive care.
Makes sense. So for many of our listeners, if they go all the way back to our very first episode, we talked about a framework that we call 1.0 to 4.0. And for those listeners today who haven't seen it, 1.0 is basically bricks and mortar healthcare where we implement these systems of record. 2.0 is systems of insight where we deploy analytics tools and other capabilities. 3.0, we're beginning to reach out to patients and consumers and build systems of engagement. And then ultimately 4.0 is systems of innovation where we're just doing, we're reinventing healthcare, if you will. What do you think? Because most organizations think they're around a 2.5, somewhere like that. What's your opinion in terms of how these new AI-driven capabilities are going to accelerate the movement from 1.0 to 2.0, 3, and then ultimately 4.0? Any thoughts on that?
Yeah, I mean, look, I think ultimately the connectivity and the interactions using technology between patients and providers, right? That has evolved over the years in various manners. And so, I do believe that AI will play a role of an accelerator by enabling organizations to go beyond knowing what happened to knowing what is about to happen in that patient care and become more predictive. And what that means in like simple lay terms is that teams and healthcare professionals can respond to changes immediately as opposed to in a delayed manner. The decision makers can get clarity without waiting for analytics reports or operations simply because of the way the technology has evolved now, where before we needed structured data in order to analyze it and to take action. Now, all of those steps can happen in real time using AI.
I think the key there is real time. And you mentioned to predict what's going to happen. And I'm also hearing some people talk about to determine what you want to happen and influence that. And AI can play a big role in that. How do you define to someone that doesn't know a lot about AI what it means for AI to be kind of native in a company's DNA, or we use this phrase AI first type company, as opposed to what we've had traditionally, where things might have just been a bolt on or an adjunct to the system itself? I mean, how do you explain that in layman's terms?
Yeah, I'll try my best. But in truly, this is where the healthcare journey moves from collecting data to truly understanding it and acting on it in the process of patient care, right?
Mm-hmm.
And so when we think about AI native applications or AI native software, it's built with this expectation that there's AI enabled intelligence available at every step of the way in that process, whether it's an EMR, whether it's a point solution that's being managed for certain process or activity within the health system. And so with AI native, the systems are designed to not just collect data or facilitate process, but they're really designed to adapt, interpret, and guide the user in providing care. And those workflows are integrating the capabilities of AI, again, from going from a system of collection to system of interpretation that can be utilized in that process. Whereas the bolt-on that you're talking about, and to be honest with you, in some cases, we're actually at a place where a lot of the AI is actually bolted on as a layer to what the existing technologies and tools are, simply because it will take a little while in the future before all the systems get turned over to be what I would call AI native. And so what happens is that you have your traditional systems or tools, technology tools, and AI becomes a layer on top of it. It becomes an accessory where it allows the user to use the information as a chatbot or as a helper, as opposed to embedded in the workflow of each and every step. And so the user still has the ability to utilize a co-pilot or a chat agent as a tool, but it's not fully integrated in the workflow steps where AI could take data, interpret it, make decisions on its own and guide on its own. So it's a little bit of a journey or a transition period where we're going to see bolted on AI on top of existing tools, eventually those tools transforming into what I would call a truly AI native application.
Well, that's actually, I think, very helpful, because one of, I think, our industry's greatest fears is they have to throw the baby out with the bathwater when they move to the next generation of tool. But what you're saying is those foundational systems like our EHRs are still going to be very, very important in this AI world, because it's going to access what's already in those tools, and it's going to be maybe built around it, as opposed to replacing it like we've done so often in the past.
Absolutely.
Well, one of the biggest concerns today, and I'd really like your take on this, is a lot of the data is still in silos. You've got, this EHR doesn't necessarily talk to this one. So we've, had national regulatory initiatives like TEFCA roll out to try to encourage more data sharing and more interoperability. Does AI have a role in this interoperable world, or is that a whole different technology dimension from your perspective?
No, and I truly think AI is going to actually change the way we think about interoperability. Like, again, in the old world, we were thinking about connecting databases when we thought about interoperability. Like, can one system take information from another in a standardized format, which is where like the HL7 and FHIR standards and those types of interoperability data exchange standards kind of emerged, right?
Mm-hmm,
But
mm-hmm.
what AI does now is it doesn't need structured data in order to interact with different tools. And so it can take tremendous amount of unstructured data, and normalize it and use it through the LLM models and create interoperability that's beyond the traditional linear processes that we had. It's now being able to absorb information from multiple sources and interpret it without having to standardize, without having to codify. And so I truly believe that AI is going to change the way we think about connectivity and interoperability, and it will make it much easier to connect information sources and then use that knowledge base in order to provide care and answer questions.
So you mentioned structured data, unstructured data, and LLMs. Can you define those a little bit or give a layman's explanation of what those three different types of data are and how important the differences in those are as we go forward?
Yeah, so I'll try to keep it as non-technical as I possibly can. But, structured data simply means that information that was collected is stored in a way that it's been transformed and loaded in a standardized manner. In other words, think of it like a
Like
hive
or like a template. I know that a lot of the EHRs are built on templates, which is very
exactly.
structured. Right.
So every time you load information, that data is loaded in the same manner. And even if it's not in the background of that software, it's usually transformed and loaded in a way where, for example, we take all the daily transaction data and load it in a data warehouse, so an analyst could perform analysis on that data. That's an example of structured data where everything is organized in a systematic way in a database, and there's a format and structure to it. Unstructured data is simply information that could come in many different formats and many different forms. It may or may not be standardized, yet AI has the ability to basically understand that, because again, it reads it, interprets it, and it normalizes it.
So an example there might be doctor's notes that are just entered in or transcribed into a system without it being in a standardized template.
Absolutely.
Yeah.
That's a great example
Yeah.
of a lab report that has lab values that are standard, as opposed to doctor's notes that are just, subjectively written. And that unstructured data can be managed and interpreted and organized by AI. And ultimately, I think you mentioned LLM, asking me to describe that. Ultimately, the artificial intelligence is driven through these large language models. And when we think about what an LLM is, it's nothing more than an engine that can ingest and organize tremendously large amount of information in a way that it is able to see patterns that a human brain simply doesn't have the capacity to manage, right? And so the artificial intelligence allows us to process, capture, and analyze patterns into data at a much more faster speed, and thereby produce that artificial intelligence that is beyond what a human brain could do in a certain time period.
So let's talk a little bit more about Polysight and what the AI that you're using to build the company is actually doing, and ultimately, what problem are you solving? What opportunity are you creating? And how will AI be operationalized within Polysight?
Yeah, and so thank you. Look, as I said earlier, healthcare is probably one of the most heavily regulated industries, where there are regulations coming from federal, state, and local level. In addition to that, you have agency guidance that help interpret what those regulations are and trying to put that into practice in running a healthcare organization, whether it's a large health system with multiple hospitals or even a physician clinic group that needs to comply with regulation. And so what we're doing at Polysight is solving that problem of not only capturing all of the various regulations in connecting that to an AI LLM, but to monitor and to ensure that any changes that occur throughout the regulatory governance, legislative process, we capture that and we analyze and interpret those regulations in a way where we have disparate, different sources of regulatory information coming into our platform. Our AI is then organizing that information in a very systematic, structured manner based on different domains and subjects, and creating and generating summaries that are easy to understand and utilize by administrators within a health system, so that the regulatory change management process becomes much more manageable. And instead of it being reactive, it's proactive, because again, as I said earlier, AI models have the ability to consume and ingest large volume of data and information to simplify and summarize it so that it becomes more consumable in the day-to-day practice, whether you're a compliance officer or a frontline practitioner. You could use that knowledge to ensure that your patient care processes are in compliance with regulatory expectations of how you're supposed to operate.
Well, that's great. And I can think of all types of applications in the regulatory space. And, in so many health systems and other groups as well, other companies as well, have to put so many people in that compliance space just to even stay current with what the requirements are. But I guess as you're out talking to people, do you ever encounter concern that AI is going to replace the jobs of those compliance people? And can it really even understand it at the level that some of those people who've been in the compliance space for years can? I mean, do you see the work being transformed, or do you see positions being replaced? I mean, what ultimately will be the outcome of bringing AI to this regulatory space?
Yeah, it's a good question. And, interestingly enough, Pam, it's probably one question I don't get asked directly, but as I interact with people and I tell them about how AI can be utilized in their day-to-day work, there's always this fear of the unknown, right? And I truly believe it is fear of the unknown, because when we think about healthcare and even other industries, but particularly healthcare, healthcare has always been a profession built on human connection. Like, we're taking care of patients. And even the most advanced technology can only augment that relationship, not replace it, right? And what people often forget is that, what AI does exceptionally well is that it takes on that cognitive burden of work that has become so burdensome for the frontline staff, because they're literally like, how many times have you gone to the doctor's office and your physician is literally typing in EHR more than they're looking at you and talking to you?
Right.
So using that example, AI has now the potential to understand the conversation that's taking place between you and your physician, for example, and turn that into notes that can be added to an EHR, and that provides that physician FaceTime with patient, as opposed to sitting in front of a computer and just typing away. And so I think what I'd like to always remind people is that I think it's not that AI will replace humans in a job, any type of a job. I think it's humans with AI will replace humans that are not adapting to AI, because it's a matter of figuring out a way to utilize the latest sort of technology to make your job easier, and use those tools to focus on the value you bring to the table as a healthcare professional, for example, instead of focusing on the administrative work. And so in case of Polysight, for example, certainly the task of manually monitoring every regulation that a health system is responsible for complying with is enormous. It takes,
huge.
It takes, as you said, number of people to keep up with that work. And so if we could automate that monitoring and that alert and those flag notices that can provide guidance of, hey, these are the changes that are taking place in these regulations, then instead of focusing our time, effort, and energy on manually finding updates, that staff could focus on actually taking action and implementing that change throughout the organization. And so, we aspire to continue to build not just the regulation monitoring capabilities, but those regulatory change management capabilities in an AI native platform within Polysight to be able to support a compliance function within a health system.
So it really allows the compliance, let's say, subject matter experts or decision makers to truly work to the top of their knowledge base, as opposed to doing a lot of the routine, kind of like you said, the administrative functions that just take so much time today, and sometimes get in the way of you doing the bigger picture, more difficult thinking.
Exactly. And I think like it's really important to help people understand that the role of AI is not to replace staff. It's almost like, back in the day we had maps that we manually read, and now we have GPS. But
Right.
maps didn't go away because GPS came about. We still
Right.
need maps, right? And so I think we need to move the conversation away from replacement to partnership. Like, how do you use AI native or AI enabled applications as a tool to do your job better, to best utilize your expertise and your time in doing work that you're trained to do, as opposed to administrative work or work that is tedious in nature, that requires a lot of manual processing that AI can do now because of its ability to manage data, whether it's structured or unstructured.
Yeah, I know I've got a couple of clients who are all caught up in the legal definition of what AI is and what they should or shouldn't do with it. And I'm just encouraging them to get comfortable with it. Go out and try a chat GPT if you're writing a report, or begin to learn. And I guess if you had someone ask you what you would advise them to do, if they were a clinician, for example, what essential skills do they need to become AI literate? Not necessarily technical, but be able to use it from a operational or strategic or even ethical standpoint. I mean, what skills can they develop at this point?
Yeah, and I think the answer kind of lies around the trust in AI, right?
Mm-hmm.
Because again, right now in healthcare in particular, there's this big question mark about whether you could use commercial grade GPTs, whether it's ChatGPT or something like that.
Right.
And the reality is the commercial grade tools are not made yet for regulated spaces like healthcare. And so I think what's important for people to understand and appreciate is that the foundation of AI governance in healthcare has to start with that trust and that transparency. I think what people need to know and what they need to focus on, skill is a one thing, but I think understanding where AI is grounded is, I think, really, really important, right? Because if they understand the fact that companies like Polysight, right, we're developing tools that are not going to make up or hallucinate. They're grounded with guardrails, they're validated, and the source of the information is coming from, authoritative origin, right? It's not somebody's blog that's giving guidance on what regulation changes are. I think it's understanding that is a first step, and then utilizing that without the fear of their jobs being replaced, and using those tools as a partner to enable your workflows in a much more efficient manner is sort of the secondary thought process. As far as skills are concerned, Pam, I think it's taking that first step of keeping an open mind, understanding what AI is safe to use, what AI is not safe to use, right, between these tools, and then embracing that change. I think, as we all know, survival of the fittest. We have to make sure that our clinicians are trained to not necessarily prompt engineer AI, but to adapt and to use that information or tools that are available, and find ways to use that in their day-to-day workflows more from a interpretation, guidance, and knowledge source standpoint, rather than relying on those tools to just make decisions.
Well, and it's going back to your wonderful analogy earlier about a map and a GPS. You still have to know where you're going on your journey. You want to go the slow scenic route, or do you want to get there as fast as possible? Are you comfortable driving on interstates, or do you want to take back roads? I mean, all of those are still up to you, the driver. And I think the analogy is the same in, if this is your area of expertise that you're already working in that function, like the regulatory or compliance function, you still will be relying on your knowledge of that space and the work you've done over your career to help make decisions and help map out that journey. You're just not going to randomly go wherever your map app points you unless you're really not paying
100%.
attention, which I guess happens sometimes. But
sometimes that happens, but like you rightfully said, right? AI literacy in healthcare for people is more, it's less about understanding the algorithms, and it's more about understanding its value, its risk, and its responsible adaptation. Just like the GPS, if it tells you to make a left turn into a wall, you're not going to make a left turn into a wall.
We hope.
We hope, yes.
Anyway, well, so you built other companies before you started Polysight. And what is different today about starting this company and launching this company in the age of generative AI and other things than some of the companies you started previously?
Yeah, it's different. I can tell you, the expectations are different, right? And the responsibility is different. And it's building in the era of AI feels different because there's a heightened awareness that when we're developing systems and processes, we need to be completely mindful, especially in healthcare, especially in the work that I do at Polysight, for example, that we need to ensure how and anticipate how users will rely on the platform like Polysight for decision making. Again, in the old world of SaaS technology in healthcare, the decision making was left up to humans because the systems were only recording, collecting, and organizing information. In the world of AI, they're doing those things, but they're also providing information retrieval with interpretation and decision support. And so I think what's different now is to ensure that in the design process, there's intelligence built in from day one, as opposed to building around system databases and things like that. And most importantly, it's that trust, that transparency, and that ability for our customers, for example, or users of the platform, to know exactly how much they could trust the platform and what decisions are aided by AI and what decisions they have to make on their own. And providing that clarity in building not only the company, but also the tool is very, very different than what it was with previous systems I've built in healthcare.
And since several of your other companies were also in healthcare, are there any unique challenges? I mean, you mentioned the trust, you mentioned kind of the ethics around the data, et cetera, earlier, but are there any other unique challenges that healthcare AI startups have that maybe aren't as important or critical in other industries?
Yeah, and I'll expand a little bit on that because again, healthcare AI is not like consumer AI. Like it's not like ChatGPT. You can't just scrape the internet and train a model and hope for the best, right? The environment is regulated, the stakes are high. The tolerance for error is extremely low. And so it's really, really important that the validation of what you're putting out there, is accurate. And that access is built around trust. And the trust requires transparency and making sure there is, verifiable sourcing of information and that citation that's provided back to the user. And so I think what's more complex or unique to healthcare is that the validation is more complex, and a model cannot simply, sound correct. It has to be correct. And so
Yes.
the higher level of tunability and transparency that has to be established, especially with AI native applications.
Well, that's really interesting. I bet it's different as you're out raising money from investors from the firm. I mean, they probably got expectations around AI that maybe they didn't around some of your previous companies. Is that fair, or they still have the same expectations?
Yeah, no, it's fair. They absolutely have different expectations, because I do think investors are excited about AI, but they're more interested in learning. Are you solving a real problem, or is this just another buzzword that's being added to a SaaS platform? And I think, as entrepreneurs that truly innovate solutions, right? As they think about, the defensibility and the depth of what they're building, I think investors, will definitely dig into understanding, are these applications accessory? Like in our earlier conversation, we talked about how AI could be bolted onto an existing platform, and there are lots of tools that are doing that very successfully. Or is this an AI native platform, not a point solution that's going to evolve a tremendous shift in, how an entire function is organized? And so maybe I'll use Polysight as an example again.
Sure.
We started with regulatory monitoring and interpretation, but our architecture is designed to support policy alignment, risk management, accreditation workflows. So as we continue to add those features that are AI supported and AI native, we're truly solving a very complex problem of not just compliance, but managing governance, risks, and compliance within a healthcare organization. And so I do believe investors look for those types of strategies in understanding viability of your platform or your solution, whatever it is that you're building, and make determinations on what the ROI would be for their investment.
Sure, that makes sense. What about the users of the system? I know you've recently launched where you've got real customers with real users working in your tool. Are they just so excited they want to get in and start working with it, or are they a little reserved? I mean, where do you see the typical user that gets exposure to Polysight? Where are they in terms of enthusiasm about AI?
Yeah, well, I'm very fortunate, Pam. I'm very excited to be partnering with the team over at Wellstar in particular to launch Polysight's solution. And I think they've been waiting for a tool that is, again, safe, trusted AI, grounded, and not a commercial GPT, because they see the value from their day-to-day life in how AI can help support them in their compliance related tasks, but not having, again, that tool up until now, up until Polysight launching, where they can have access to using grounded AI that is safe to use to monitor regulatory change. They're excited. They're using the platform, and we hope we could continue to enhance and build our content libraries to provide more and more and more knowledge base on the regulatory content at federal, state, and local level to help them carry out, again, those not only those monitoring but regulatory change management processes. So they're definitely excited. We're definitely looking forward to adding more users from different realms and getting their feedback on what their experience is like. And so far, so good is what I can report back to you.
Well, that's exciting. And one thing I've been thinking about a lot lately. So over the last decade, we had a lot of startups and new companies. And typically the way they would scale they would either add additional functionality or adjacent spaces, or they would be aggregated up into a larger platform system through an acquisition or something. But in our health systems still have thousands of point solutions. Christine Valdez, who's CEO of a healthcare company, and she spoke in one of our earlier episodes. She says that the average health system has at least 3,000 point solutions. And a lot, and you know, the challenges there, these point solutions, their data doesn't connect with each other. They're off kind of in their own little bubble. They don't tie sometimes they do, but they don't always tie to the bigger enterprise systems or platforms. Are we at risk? Because these AI first solutions can really zero in on a micro problem. It can be something very targeted that they help resolve. Are we at risk of having a lot more, like a proliferation of AI driven point solutions? So we got a whole new category, or do you think that will resolve itself over time?
Yeah, definitely agree that, healthcare has accumulated technology like a way a house accumulates clutter, right?
Yes, that's a
There's
good
just so
explanation.
much,
Yes.
so much there, and each point solution, solves a narrow problem. But overall, we've seen this, right? The overall ecosystem at 3,000 different, applications becomes really, really hard to manage. I can't even imagine what the challenge is from security and data access
Oh,
standpoint
yeah,
for
it's huge.
hospital or health system CTOs right now, right? And so I think, again, as I said earlier, I think there are two opportunities. One is, I think there's that middle ground where AI sitting on top of these various point solutions will start to consolidate and create solutions that are easier to manage and interface. And eventually, as those dots are connected, the AI first companies, will have the opportunity to break that pattern of point solutions by designing, again, AI first, AI native platforms that learn across functions rather than solve like one problem or one isolated task at a time. And so instead of creating another silo, I do believe that AI for startups will provide a more connectivity or connective tissue that kind of helps the organization see relationship between different processes, different decisions, obligations through these different applications, transitioning into sort of a one enterprise platform for different functional areas rather than point solutions. And so, you might see a little spike in the beginning of AI tools being added, but eventually that will clean out to be a much more integrated ecosystem.
Well, I mean, and what you're really describing is I had guests a few months ago who talked about a unified data platform for healthcare. And Gartner has talked about that will sit on top, not just at the enterprise level, but probably across the ecosystem and pull a lot of these things together. And so it's almost like you're describing as an operating system for the AI driven components of the organization. Of course, we're a ways away from that, but it does tell me that there will be logic and reasoning and governance of these tools. We're not just going to be randomly out, throwing AI at every problem out there and them all not connecting or working well together.
Yeah, and I try. The reality is, Pam, AI can't solve every problem
Right.
these systems have. As great as AI is, there are limitations of what AI can and cannot do. However, that orchestration enabled by AI between different tools will definitely create a shift around ease of use and create more harmony in being able to use these tools across different functional areas within a healthcare organization over a period of time.
So one of the questions I always like to ask, are there things that keep you up at night regarding AI, whether it's, an ethical issue, an equity issue, or some other challenge that you find yourself at 2 a.m. thinking about and wondering about?
Yeah, I mean, interestingly enough, I have I have a group of friends who are HR professionals, and I talk to them about AI, and, there's definitely a possibility that, AI could like widen, disparities instead of closing them, because you'll have, one group of uh, individuals in the workforce that embrace what AI is capable of doing, and yet they're going to be attuned to understanding how that AI is trained, and can see the biases that AI could bring back into the workflow. And as it is, healthcare already struggles with inequity, and we have to make sure AI doesn't amplify it. So I always think about, like, how is that going to work out in the long run, right? Like AI and the biases, how are they going to impact inequity and those types of things? And again, I'm hoping that I'm right in that transparency and being able to create very clear trust guardrails on what AI cannot do in healthcare is going to become more and more important. So I do think about what AI governance will look like, but then, another part of me thinks, well, we overcame what security governance
Absolutely. Right.
looked like before before and after. We were able to think about, HIPAA and some of these privacy governance matters, and just like those big challenges in healthcare over the years, whether they're privacy or security requirements, we'll have to come up with AI governance challenges as well. But it will require a lot of collaborative effort on part of innovators and administrators in order to come up with a fair and balanced approach. Because the risk is, if we're too much risk averse, then we may not really benefit from the use and adaptation of AI. And as is, healthcare has always been a laggard in terms of technology adaptation, and we don't want to be left behind. So I think about those things. I'm not the person that could solve all of those problems, but I'm certainly a person that thinks about those problems, and I try to address them as best as I can at Polysight.
Well, one of the things I think quite a bit about is, as our industry evolves and as our population ages and we have bigger and bigger issues that we have to deal with in terms of the cost of care and value-based care and all these changes that are happening in the industry, I'm hopeful that the relationship between patients and their clinicians, that having AI and having data, kind of the insights that come from data available, will help us truly, get to personalized medicine and be able to do things that we talk about a lot, but we haven't been able to do historically. Are there things that you see AI reshaping that relationship between the clinicians and their patients because of its capabilities?
I truly believe it. Not just I think about it, but I truly believe we will get to a place where providers will have a better relationship or better connectivity with the patient than what currently exists, mainly because of the administrative burden of documentation, right? Using the right tools in that care process will, again, enable healthcare professionals to spend more time providing care, not being bogged down by administrative burden of documenting care.
Right.
That
And
being said, the second area I truly believe is going to enhance patient experiences, the holistic approach to care. Right now, we're so fragmented. One specialist doesn't know what the other specialist is thinking, doing, just because there's vast amount of data that is in EMRs that's fragmented. And even though interoperability exists, it's still fragmented. Whereas
absolutely.
adding AI and getting all that pulled together, summarizing it, and serving that to the care provider before they engage in the care process is going to allow a more holistic approach to care as opposed to fragmented. So these are a couple of areas that I truly believe AI will transform and improve that patient experience.
Well, let's keep our fingers crossed on that for sure.
Absolutely.
So let's fast forward 5 years from now, and all of this great stuff we've talked about has come into fruition. What does success look like in your minds for AI in healthcare, and then for your company Polysight?
Yeah, I guess in general in healthcare, 5 years, in greater scheme of things is not a lot of time, but the way AI and technology is evolving, I would hope that, success for AI in healthcare means that intelligence, that ability to use AI as a partner in providing care becomes more natural part of everyday workflow. That's
Right.
To me, that's what success would look like. Not that AI is intrusive, not that it's overwhelming, but it's kind of quietly present. It's like that earlier example I gave about a physician and a patient interaction. AI could be present, listening to the conversation and interpreting notes. It's not intrusive, but it's part of providing care from the sidelines. And I think if that relieves the burden from clinicians and they feel supported, I think we've achieved our goal. That's what I think in terms of healthcare. In terms of Polysight, I do hope that Polysight becomes the primary AI native platform for managing governance, risk, and compliance in health systems or healthcare organizations, which means not just kind of managing and monitoring regulatory sources and interpreting, what regulatory change is taking place, but it actually would enable alignment of policies, procedures, accreditation, readiness, and give leaders clarity about what needs to happen next whenever there is a regulatory change. And so that's what we aspire to be. The future is possible, and we're building it and we're laying the foundation for it today. So we're excited about what it will look like in 5 years.
Well, that's very exciting. So I always end my podcast with asking the guest one question. And I would like to know, what's the one thing we should have talked about today that we didn't talk about?
Oh, wow. I think we could focus more on helping people understand a little bit more of how AI technology functions and what a prompt engineering means. Pam, I know you asked me about skills earlier, and I didn't talk a lot about that just because I think it could be a topic of its own where people need to understand how to talk to AI, although it's natural language processing. In other words, you just like you were asking me questions on this podcast and I was responding, it could be as simple as that. But I think the response and the quality of response, specifically when you're interacting with AI tool, could be tremendously improved if users had understanding of how to provide context and how to provide more instructions to AI. So maybe, it's a topic you could take on for the future.
Well, and it gets back to that map. If you've never gone on a journey and driven a car with a map, it's going to be out of context if you're using a system that ask you all these questions like, where are you going and how fast do you want to go and what type of road do you want to take? I mean, you need a little history and a little background, a little skill set to do that. So actually, that's a really great suggestion for one of our future episodes. Well, thank you so much today. I thought our conversation was very interesting. Good luck to you and Polysight and your customers as you grow on this great journey together.
Thank you so much, Pam, for having me. This was definitely a fun conversation.
Great. Thank you.